Chapter 5. Question 1. Identify the measures of patient safety in the most current edition of Agency for Healthcare Research and Quality, AHRQ, National Healthcare Quality Report. According to this report, are the aspects of patient safety being measured showing an improvement trend? If not, suggest ways of improving patient safety performance in this area. Now, the latest version of this National Healthcare and Quality Report was in 2013, and it addressed several factors in the hospital setting, the nursing home, home health, ambulatory, and infrastructure. I will look at and examine the hospital setting and address several issues: hospital-acquired conditions overall, post-operative sepsis, catheter-associated urinary tract infections, UTIs, central line-associated bloodstream infections, CLABSI, surgical site infections, and medical adverse events associated with central venous catheters, and obstetric trauma. Now, in 2011, the national overall hospital-acquired condition rate was 142 per 1,000 hospitals. By comparison, the rate was 145 per 1,000 hospitals discharged in 2010. As many of you stated, many of the safety measures addressed had showed some improvement. Now, how do you utilize this data? You can utilize this data for your patient safety initiative projects. You can utilize this for improving projects. But you must first have buy-in from senior leadership, physicians, nurses, and all stakeholders for improvement. There's various projects that can be utilized, such as hand washing, better communication. These projects are ways in which we can address. The purpose of this question 1 was so you can better utilize and understand, not that you see things that are necessary you want to fix, but you can actually look at a database of issues that are a major concern in the hospitals. And we as doctoral level clinicians can address these issues by doing a patient safety initiative project. Question 2. Utilizing the most informative information available in the AHRQ Hospital Survey on Patient Safety Culture Comparison Database. Identify which aspects of hospital culture are most problematic and suggest ways of improving these aspects. Now, the whole purpose of this question was for you to utilize the 2014 User Comparison Data Report. It's a great database for patient safety projects. So hopefully now that you have familiarity with this this area, then you can utilize this to complete your patient safety projects. Now, the areas with potential for improvement for most hospitals, there were 3 areas. They were non-punitive response to error, handoff and transitions, and staffing. Now, many of you suggested great ways in terms of ways that you can improve. We all know that the shame and blame does not work in response to errors. We can reduce our handoff transitions by reducing the amount of handoffs we have, or have a systematic process such as SBAR to communicate to ongoing practitioners, and appropriate staffing in terms of workload can also improve the safety process. So these are some ways in which we can utilize that information and come up with patient safety projects to reduce these events from occurring. Concerning question 3, chapter 5, what challenges are associated with creating a national network of patient safety database? How can the federal government and healthcare organizations assist in overall these changes? Now, if you have combed the literature, many of you have, and understand that the federal government created the Patient Safety and Quality Improvement Act in 2005. So Congress created this. Now, it is not mandatory, but they encourage this. And what this network has created is a voluntary measure in which hospitals can create and report information of mistakes. Now, this is very important. The PPC provides protection, and it provides non-identifiable data submission to report to the National Patient Safety Data, and provides technical assistance to use in a common format. So the federal government has created a conduit for healthcare to utilize. The barriers to doing this would be, healthcare industries themselves, because of funding and because of resources, they can't do that. But this act, the Patient Safety and Quality Improvement Act, and this act was coming to be as a result of the 44,000, 98,000 near misses or medical mistakes that was reported into ARIS Human. So this is a result of that process that the federal government came up. So institutions can voluntarily report issues. Chapter 6. What are some advantages and disadvantages of quality, cost, opportunity of failure or failures in healthcare organizations? Some advantages. Opportunity analysis can be reactive or proactive. They can calculate the measure impact. It can identify trends, patient safety. Some disadvantages is the cost, financial justification of patient safety project. Patient safety is always number one, but if you look at some of the bottom line figures, it might be looked at as this project might not be worth doing. But in other words, the end goal and the top goal is patient safety and quality. The cost-benefit relationships is also a disadvantage. Question 2. How can opportunity analysis be applied to patient safety improvement opportunities? And this is what I was talking about earlier. The opportunity analysis is a systematic way to identify possible failures in the system. As we now know from our reading and our videos, that it's a systematic process, and it can be utilized to redesign and improve process, reshape paradigms, and improve systems. It can be applied proactive. Proactive, what I mean, so it's in our patient safety initiative project is a proactive response versus reactively, where we're looking at after a medical mistake happens or after a sentinel event occurs. Then we do a improvement process. So the proactive way is, in my opinion, a better way to address a patient safety issue, because you can look at the data and you can see ways to improve it. Question 3. What are the risks or not recognized significant few events causing the greatest loss? Well, number one, bottom line, patient safety, the zero tolerance or no lives lost is a high priority. They will continue to harm patients if we don't recognize that. They will cause undue risk to healthcare providers and our patients. And they result in second victim response and third victim response and excessive loss to organization. Thank you.